for me okay? And you are in the stream as we follow the coronavirus pandemic in different countries around the world. There are certain similarities that we've got used to seeing. Do medical professionals have the equipment they need? What is their healthcare system like? How resilient is it? How are people handling lockdown? Well, today we're going to look at those challenges in the context of Russia. So if you have experiences or stories or questions that you want to ask our lineup, you can do that by jumping in the YouTube chat. Let me introduce you to our guests. First of all, Piotr. Piotr, welcome to the stream. Please tell our audience who you are.
Thanks for having me. My name is Piotr Sauer. I'm a Dutch-Russian journalist based in Moscow, working for the Moscow Times. We are a on-the-ground journalist team. The oldest independent newspaper in English language newspaper in Moscow.
Good to have you. Hello, Mark. Welcome to the stream. Tell our guests and our audience who you are.
Hi, I'm a Moscow-based international affairs and security analyst.
Nice to have you. Anastasia, welcome to the stream. Tell everybody, what do they need to know about you? Who are you?
I'm a doctor ophthalmologist. I'm treating eyes in Moscow, and I'm a leader of trade union named Alliance of Doctors.
Mm-hmm. It's good to have you guests. We were trying to get on the stream an official Russian voice, but we got an email back, and this is what they said to us. Thank you for your very kind proposal. Anastasia Vasileva from the Doctors Union is an opposition group. We do not want to be part of a political show. A substantial discussion should include, and they suggest who we should include in the discussion, and it is the doctor of Moscow's Kommunarka Medical Center for coronavirus patients. And they then go on to say that that doctor has recovered from COVID-19 and is now working in that hospital, helping others to recover. Best Russian Embassy press office. Very polite, but a very firm no. So, Piotr, I am wondering about setting the scene. If I went to Moscow, how would I see the coronavirus pandemic playing out? What is different now that wasn't the case back in January?
The mood has shifted quite a bit. Back in January, Russia was quite calm about the coronavirus. They did close the border with China early on, but for a long time, Putin and other officials said everything is under control. There's nothing to worry about. The numbers seemed to be low for a long time, although myself and other journalists had their questions regarding the testing, whether the testing really was, really legit and solid. But since then, the mood has shifted. Russia now has 93,000 cases of positive coronavirus patients, and Putin himself said that we aren't even yet at the peak. So the mood has shifted. The officials are more worried, and Russia itself is on a lockdown now. Across the country, and doctors have raised the alarms that a lot of hospitals are full, are understaffed, medics aren't prepared enough.
Mm-hmm. Mark, I'm just wondering, lockdown life, what is that like? Give us an example. What's open, what's not open?
Okay, so each of Russia's 85 regions, and Moscow City itself is counted as basically as a region for these purposes, has different specific lockdown measures. Moscow has one of the tightest regimes, and a lot of regions have followed suit on Moscow. In Moscow, first of all, if you don't have essential work, you are on an official non-working paid holiday where your businesses, your employers are supposed to keep paying you your salary. And that has been for a month now. About 40% of Moscow's normal traffic on the roads and the metro indicates that that's roughly about what is considered essential, which seems a little bit excessive. But so at least 60% of the population is supposed to be sitting at home. They're allowed to go to the nearest store to get groceries and supplies. They're allowed to walk their dogs. They're allowed to seek medical help. But other than that, and take out the trash. But other than that, they are not supposed to leave their homes. Now, I live in South Moscow, right on the edge of a forest reserve, and there's a lot of Moscow is a very big city. There's a lot of different conditions. As far as I can see, the people in not following the quarantine at all. They're treating it like a holiday, as the government treated it. They're out, teenagers drinking in the woods, people out strolling, big parties, shashlik barbecue out in the woods, and there's very light horseback police presence. So basically, in the forest where Russians think they can get away with it, in Moscow at least, where I live, they're not following the quarantine at all.
Oh my goodness, so that sounds like lockdown light. Let me tell you about Elena Menina. She is an associate professor at the Higher School of Economics in Moscow, and she told us earlier on the stream about the rumors going around about COVID-19.
Amid the barrage of misinformation relating to the coronavirus situation here in Russia, perhaps the most damaging are unfounded medical claims spread by some members of the medical and lay community. One, for instance, is that a special kind of vodka and lemon drink can kill the virus. Another one is that the BCG, the Soviet strain of the tuberculosis vaccine, is somehow so uniquely potent that it's created a kind of a herd immunity against any kind of pulmonary infection in the Russian population. These beliefs feed into broader popular cultural narratives of Russia's exceptionalism and generally not fitting into any existing pandemic or otherwise social models. In practice, of course, this translates into a lot of people underestimating the risks involved.
Anastasia, as a doctor, how much do you feel that the citizens of Russia understand the coronavirus pandemic? Do they know what will keep them safe?
So you see, the population of Russia is divided into big parts, and one part is understanding the situation, and these people understand, and they don't go outside, and they're sitting at home, and at least. But other part really doesn't think that this disease is severe, and they don't trust that this disease is very difficult to treat. And you see that our state television it says every day that everything is good, that there is no pandemic in Russia. And of course, this part of people, they don't understand this. They don't understand that it's really very dangerous to come out and to have shishaki and so on.
Yeah.
That's why.
So they don't, Anastasia. They're not.
Yes.
Yeah, it sounds like they're not appreciating the risk. But President Putin has just talked about the situation being dire, that they're not at the end of the coronavirus pandemic in Russia. Today is the peak. I'm not sure how that is possible to know that, but there's certainly a serious attitude coming from the president. Piotr, I'm just wondering, though, about the misinformation that has been going around this coronavirus pandemic in Russia. Is it dangerous? Are people really trying to help fight it, combat it?
Well, so it's a complicated issue. So the government actually installed a law that to prevent disinformation about the coronavirus, but the law is actually being used in a way to prevent independent media from publishing information about the virus that's often factual. We've seen independent outlets and Nova Gazeta get in trouble for publishing certain stories that the government believes to be disinformation. So if they are using the disinformation angle for their own, you may say, purposes. So it's sort of it's a complex situation we find ourselves in.
Sure. Let me just go to YouTube. Hello, YouTube. Thank you for joining in the conversation. Alex says that living in Moscow, and I can say that many people are outside, many keep working, and they're using public transport, and there also is some social unrest. Mark, is this a recipe for disaster? Are you already in a disaster situation if people don't understand that they at least have to stay away from each other?
Yeah, again, I don't think it's a matter of disinformation per se. I think it's a matter that the state authorities aren't stressing how serious the situation is enough. But it's also a fact that Russians, particularly Muscovites, have a very fatalistic attitude towards life in general. And whenever authorities aren't watching, if they think that there's no immediate consequences for themselves, a lot of them, not all, but are quite willing to break that. So I think the government hasn't stressed the seriousness enough, but I don't think it's a matter of disinformation. But whether it's a dire situation coming, absolutely. I've been talking about this for 2 months now. I think Russia is, it's quite obviously on a path, the same path, perhaps as bad as the United States, certainly as bad as Italy or France. The Russian government took some good initial moves, closing the border with China and air traffic with China, but then dropped the ball and didn't close the borders with Europe when the epicenter moved there quickly enough, and hasn't stressed enough how dire the situation is. So I think Russia is going to follow the path of a lot of European countries, and it has a much larger population. And in some areas like Moscow, a very high population density. And it's going to result in a lot of infections and a lot of deaths that perhaps could have been avoided otherwise.
Yeah, if I may add to sort of Mark's words, I think a big factor why a lot of people are on the streets still, because a lot of them also have to go to work. The government did not give out big economic, packages the way we've seen, support packages the way we've seen in the West. A lot of small, medium businesses are struggling financially, and they often don't have a choice but to continue working. Some do it illegally, some do it under the risk of getting fined. So a lot of people also, even if they want to stay home, they don't have the opportunity to, just because the Russians don't have much savings and they're not getting the state support many, maybe have hoped for.
Anastasia, I want to put a question to you that's coming from YouTube right now. Goal Football Management, hello, thank you for being part of the show today. I don't think Russia's official figures regarding COVID-19 are genuine. Anastasia, do you feel the official figures are the correct figures?
You see that really our president and government, they try not to move the population to the panic. I see, and but I know that doctors and medical staff in hospitals have a lot of problems with protection, with equipment, and this problem is very severe for everybody in Russia, because without protection, without equipment, doctors can't work really. They can't work good, and and they can't treat the population. That's why our figures, political figures, as Putin and his government, they just telling their tales about millions of protection of masks and costumes, but they are lying really, because a lot of doctors they have no enough equipment and no protection, because I think it's my opinion that our official figures, they don't understand the real situation maybe, but they should think a lot about the situation in the healthcare system and try to help doctors to get this equipment and to get protection.
Anastasia, one of the things that the Doctors Alliance is doing, and you're at the forefront of this, is taking equipment to medical professionals. Tell us a little bit more about that.
President have said a week ago that in Russia there is a lot of equipment, a lot of millions of masks and costumes, but we try to trust him. But every day our trade union, we are receiving about 10 letters, about 100 letters a day, and medical staff, doctors, they are asking us to help them to to send them equipment, to send them masks, simple masks and simple gloves, because they have not enough, and they are working with fire, without anything, so without any protection. And a lot of doctors now are sick, and about 100 doctors died. And it's a very great pity for everybody. And I think that it's a blame of our government and Putin, because within 1 month, even 2 months ago, we have told them that they have to supply medical workers with equipment and with the protection, because if doctors are dying and are sick, they will not treat.
Anastasia, this is a story that we have seen repeated many places around the world. I'm looking here at Medusa in English. This is a Russian publication, but they also publish in English as well. And it says here that Russian doctors have started tracking the deaths among their own ranks during the COVID-19 pandemic, and the numbers are much higher than the official stats. Piotr, you have dug deep into what is happening in the healthcare system in Russia right now, trying to deal with COVID-19. Headline here: Russia's healthcare system faced cuts for years. Now, medical students are on the coronavirus front lines. Tell us more.
Mm-hmm. Yeah, so we've tried to really understand what's happening in the hospitals in Moscow, and followed fourth and fifth year medical students, guys and girls that are as young as 22, 23, who have been on the front lines of the battle against, the coronavirus in Moscow. And a lot of them have been enlisted as volunteers. A lot of them are not even paid to do very dangerous work, just because there haven't been enough nurses. There have been a lot of cuts over the years. Russia hasn't really invested in its healthcare. So a lot of these young, quite brave students volunteered and had to go and serve in hospitals, despite the fact that all the risks they were facing. As Anastasia said, more doctors have gotten ill, and quite a lot have died, actually, more than government has officially accepted. Last week we were the first ones at the Moscow Times to actually to write about the doctor that died in a veterans hospital in Moscow. Since then, as you mentioned, doctors themselves have made a list, and it seems that the list is much higher than just one person. It's now up to 100 doctors. So yes, the situation for doctors has been quite bad, and we've seen this happening all around the world, and it's a shame that Russia didn't look at like what was happening in Italy and in Spain and try to protect their doctors a bit better.
So, guess we've learned today from President Putin that, learned this week from President Putin that May the 11th, the lockdown is extended until May the 11th. We spoke earlier to Felix Light, who's a freelance journalist. He's currently reporting under lockdown conditions. And one of the things that he was focusing on was how big Russia is, that outside of the Moscow culture, there are many areas of Russia that cannot stand the economic recession that will come from an extended lockdown. So that is really important.
So even though the lockdown regimes are being fairly well observed in the biggest cities, in some of the more peripheral regions like the North Caucasus, where the population are generally not ethnically Russian, they're a lot poorer. In these regions you have a sense of kind of cultural distance from Moscow coming together with local concerns about poverty, about corruption, about unrest, really coming together to create quite an ugly situation. So you have public protests against the lockdown orders, you have the spread of kind of conspiracy theories about the virus and about it not existing. And all of this really is kind of fueling the spread of coronavirus, really in the parts of Russia that are frankly least able to cope with it on an economic level.
This is why, and again, it's not just Russia, but this is why countries who know that lockdown is going to help are thinking, how long can we keep doing this? But if you have a population who is living in rural areas, who have almost nothing, who are very poor, Mark, how is Russia going to cope?
Well, Russia is going to suffer economically from this pandemic, as pretty much every country in the world is going to suffer from it. Russia, I would say, is probably middle of the pack, as far as countries go equipped to deal with it. They do have extremely large financial reserves, some $500 billion, and a rather substantial rainy day fund. But as of yet, the Kremlin has been very loath to spend it, to hand out a lot of money to employers like small businesses, because they think that this isn't over, that this is going to last for a long time, that it's not going to be over after European countries start trying to lift lockdown in a few weeks or a month, that this is going to come in waves across the world, and that this is a phenomenon that we're going to see for the next year or two. And that this virus has the potential to become a seasonal virus that is going to keep afflicting the world, that we will see periods of economic lockdown, loosening of restrictions, increasing infection rates, death, and when countries start opening their borders, then we get to the real problem, because everyone is treating this like a national problem right now when it's an international one. You can't keep your borders locked and your country locked forever, even if you beat it at home like China did. As soon as you open your borders, your safety measures are only as good as the safety measures of the worst country in the world. And there is going to be a lot of failed states collapsing over this over the next year.
Mark, can I just put this to you just very briefly? This is on YouTube, and you can push back if you want to. A. Adam, thank you, says Russia will be the lowest hit rate country as the country is locked down compared to other European countries. Mark, quickly respond.
The lowest hit rate, meaning that it will suffer the least? No, that's certainly not true. Russia will suffer as badly in comparison as many other European countries have. And it has a larger population. Russia is not going to come out of this unscathed, and anyone who says so is wishful thinking.
I have been looking at a number of President Putin's addresses, his speeches. His demeanor is always very serious.
We managed to slow down the spread of the epidemic. This is the result of our joint work, the responsibility of millions of the citizens of the country, who listened to the recommendations of doctors and specialists, took care of their health and took care of their loved ones, complied with the instructions of the authorities. The daily number of new cases of the disease has relatively stabilized.
But Anastasia, as a doctor who is working on the front line, what do you make of the leadership that you are getting from your president right now?
So we are waiting that you see that maybe 2 weeks ago he promised to pay money to the doctors, but now a lot of doctors, they writing down the letters that their chiefs, they said that they will not receive any money. That it's really very bad for them, and they get. They think that they are upset about this, and they should be supported by government, by president. And I think that every medical worker should be supported now. Not only medical worker that is treating the person with coronavirus. You see that this law and that this. President wants to support only medical workers who are treating only patients with coronavirus. But this is it is a big pity for every doctors, because they are only working. They are also working with the patients.
If I could just jump in there for a second.
Yeah, Mark, we're right at the very end of the show, so be brief with your comment. Go ahead.
Yeah, the largest doctors' union in Russia, the health workers of the Russian Union of the Russian Federation, has some 3 million members. In your Doctors Alliance that is linked with the far-right ultra-nationalist Navalny, how many union members are in your group? 500, right?
Mark brought up a huge, big conversation that we are going to take online. So thanks for that, Mark. Thanks, Piotr. Thanks, Mark. Thank you, Anastasia. This is obviously a challenging time for Russia and the healthcare professionals, as it is for many countries around the world. I want to give you a little glimpse into how Russia is coping with COVID-19. Thanks for watching. See you next time.